I'm Dr. Jeff. So I'm going to show you exercises for spinal hygiene. It is really important to make sure your spine is flexible, to make sure it's lined up properly, and to make sure it's moving properly. Your discs do not have blood supply, and so the only way you can get water and nutrients is by having proper movement. Most people have spinal problems and issues. They have subluxation, so the spine has shifted out of place, and they have decreased disc space, and they have stress on their discs and their spine. So if we can get more motion in there, that can help rehydrate the discs, and that can increase your disc space. We see people all the time, as we start working on their spine and their posture, their disc space increases, so they actually get taller. So we're going to show you exercise for the neck, for the mid back, for the low back, to increase your motion and to increase your flexibility. So you want to bring your left knee to left shoulder. You want to hold this for 30 to 60 seconds. This is stretching glute max right in here. Go across like this. Hold that 30 to 60 seconds. This is knee to chest opposite side. This stretches the piriformis muscle. And then go across like this. This is called the pretzel. You want to have the upper left body going to the left and the lower body going to the right. This stretches the erector spinae right in here. So what we are trying to do is pull the shoulders back and pull the head back. So get in here in a doorway, lean forward like this, and I want you to hold this for 30 to 60 seconds. Most people get where their head goes forward, their shoulders are going forward, so this is going to counteract that. You can also do it in a corner like this. I call that the doorway stretch, the corner stretch. First one is to stretch the gastrocnemius muscle, keeping your heel on the ground and the back leg straight, and you're trying to get a nice stretch back in the calf. Here. Next one, you're going to keep your leg back like this. Now bend forward, trying to bring your knee to the ground and keeping your heel on the floor. Hold that for 30 to 60 seconds. That's stretching the soleus to stretch tibialis anterior. Put your foot up against a wall like this, lean forward into it, and try to go as much as you can. That's going to get a nice stretch in your calf. If your hip is feeling stiff or tight, I want you to get in here and do this 90-90 stretch. So get your front leg in here, 90 degrees, back leg at 90. Get as you're stretching this hip. Count of 5 to 10, relax, and go back, count of 5 to 10. And then you can also turn your body like this to stretch it as well. And hold that for a count of like 5 to 10 seconds, and repeat that 4 or 5 times. I'll show you a couple awesome ways to stretch your quads and lean backwards. You get a nice stretch in here, go to the point of discomfort, and hold that for 30 to 60 seconds. If you bring your leg forward like this, that's going to stretch the psoas, which is right up here, and it gets really tight on us. So the first one is just a normal hurdler stretch. Get in here like this, lean forward. As you're stretching, rub the back of your leg. That will help activate that, and lean forward. Try not to get a bend in your leg. If you turn your leg out like this, that's going to get a nice stretch on the outer part of the leg. Turn it in. That's going to get a stretch on the inner adductor part. Hold that for 30 to 60 seconds each pose, and that's a good way to loosen up your hamstrings. What I like to do is called the bow forward like this. Keep your legs straight and just bend with your hips and hold that. I want to show you how you can use a lacrosse ball to really get rid of that pain and that tightness and stiffness in your neck. Up against the wall like this. That can really get in and break up those tight muscles. Now hold it for like 3 or 4 seconds in each spot, roll it around. An alternate way to do it, get in here and just lie on it, and that will really help break up the tight spots. I love the consistency of the lacrosse ball. It really helps. Now what I want to do is show you how to do repetitive cervical traction. This is going to help restore the curve in the neck. It's going to open up the space between the bones. Put your feet shoulder width apart, turn it slightly at a 45-degree angle, and you do little mini squats. So go down about a ½ inch to an inch, hold for a count of 1 to 2, and then go up, and then down. I like to use these TheraBands to help get more motion and just so we can passively stretch things. So to stretch in forward flexion, bend your head forward like this and hold this position for 30 to 60 seconds. To go back in extension, we don't use the band. Just push on the bottom part of your chin and hold that for 30 to 60 seconds. It's really important to breathe in while you're doing this. And we've got rotation. Grab your band, rotate your head right like this and hold that for 30 to 60 seconds. You're gonna get a nice stretch in here in the SCM and the scalenes. And the opposite side, hold that for 30 to 60 seconds. And then we've got lateral flexion like this, lateral flexion this way. That's how we stretch the neck for flexibility. Again, 30 to 60 seconds you wanna hold that for.